Today we will discuss about bronchoscopic recanalization of a central airway obstruction caused by tracheal schwannoma. As you can see from the video here, as we are passing the bronchoscope, there is a huge vascular tumor occupying the mid portion of the trachea and causing more than 80% occlusion of the tracheal airway. This was a complicated case of a central airway obstruction because the tumor is extremely vascular and proper precautions are to be taken prior to doing a bronchoscopic deobstruction. So a rigid bronchoscope is being intubated with the help of a fiber optic bronchoscope as a guidance and as a suction. And once the rigid bronchoscope is introduced, now you can see that the tumor is seen clearly with the help of the bronchoscope. Now an electrosurgical snare is being passed through the working channel of the flexible bronchoscope, and this tumor being large, care is taken to completely encircle the base of the tumor with the help of the electrosurgical snare. But despite snaring multiple times with a good loop around the tumor, we were not able to dislodge the tumor from the pedunculated portion because of the broad-based nature of the tumor base. So a decision was taken to partially resect the tumor and then retrieve. So now we are passing the electrosurgical snare through the mid portion of the tumor to cut the tumor into two halves so that we can dislodge the tumor. Once the mid portion of the tumor is snared, a portion of the tumor gets dislodged into the left main bronchus, which is then removed with the help of the cryo extraction. But since the tumor was quite big, we were not able to retrieve this tumor through the working channel of the rigid bronchoscope. So block removal of the tumor along with the cryo probe and the rigid bronchoscope is being attempted. Care should be taken to keep the cryo activation on during this process to prevent the tumor from getting dislodged from the cryo probe and re-entering the airway. And also proper precautions has to be taken to handle an airway emergency in case of a bleed. In this case, we were successful enough to retrieve the portion of the tumor en bloc with the help of the cryo extraction along with the rigid bronchoscope. Now we are passing the bronchoscope and we can see a residual portion of the tumor that is present in the airway. Now a re-snaring of this tumor is done with the help of an electrosurgical snaring, and once the base of the tumor is snared, now a cryo probe is passed and a cryo extraction of the residual tumor is being performed. Now you can see that we have attained a near complete recanalization of the airway. So whatever the tumor remnant that are present and that are adhered to the posterior wall of the trachea are removed piecemeal with the help of the cryo extraction. And once it is done, now we are passing the electrocautery tip to coagulate the tumor base to prevent the reoccurrence from happening. Now you can see that we are coagulating the base of the tumor, making sure that the FiO2 is less than 0.4. At the end of the procedure, you can see that there is a near complete recanalization of the airway and the base of the tumor is electrocoagulated to prevent the recurrence. In the end, the tumor was sent for a cytopathological analysis, which turned out to be a case of a tracheal schwannoma. Thank you.